Depression is, as a medical definition, and a definition according to traditional Chinese medicine. So, firstly, we'll talk about depression using conventional medicine to explain the symptoms, the types, and the causes of depression. We often define depression as either an acute depression, that means a depression that lasts for a period of 2 weeks to 1 month, and chronic depression, which may last months or even years or even a lifetime in a patient. Um, and by definition, depression is characterized by a persistent sadness that lasts for a period of time, and a lack of interest in life, which makes the patient withdraw from other people and live in isolation. So this is the definition, basic definition of depression. Depression is often accompanied by anxiety. Includingly, we use the term depression anxiety because both conditions, health conditions, often come together. But in this video, I will just will address depression only. Uh, as for the causes of depression, we have non-chemical causes and chemical causes to depression. The non-chemical causes are caused by, for example, a genetic predisposition to have depression. So if you have a parent or a relative, someone close to you who has depression or who had an episode of depression in their lives, there is a higher probability that you will also suffer from depression at a certain moment in your life. Depression is also caused by malnutrition. When I say malnutrition, I mean bad nutrition. That means eating lots of junk food, frozen food, canned food, and avoiding legumes, greens, fruits in your diet. And there's also a chemical cause for depression, which is a decrease in the levels of serotonin in the bloodstream. In this case, it is important to remember that 95% of serotonin produced by the body is created by the intestines. So the intestines, once they receive a proper nutrition, they produce 95% of the serotonin that occurs in the bloodstream, and only 5% of the serotonin is produced by the brainstem here in the brain. So here I emphasize the importance of nutrition and diet and eating health foods to increase the production of serotonin. Many studies, scientific studies, have observed that in underdeveloped countries, in which people tend to eat more natural foods, fresh foods, and food, and avoid junk foods, they have less tendencies to acquire depression, while in developed countries, as people eat more industrialized food, the percentage of the population that have depression increases. There are many types of depression, and I think that the psychiatrist is the physician which has an ample knowledge of all types of depression that a human being may present. Here we'll emphasize the most important types of depression that we can find on general routine. There is the major depression, there is the perinatal depression that occurs to pregnant women during gestation and after delivering the baby. There is a depression caused by bipolar disorder. There is a seasonal depression, which is very common in countries with temperate or cold climate during because there is less sunlight and it's colder. And there is also a very common form of depression, which is called situational depression, that's due to stressful situations like unemployment or an illness in the family or even in yourself, a problem in relationship with your partner or your family or friends or workmates, and a situational depression caused in school because of bullying. And what are the typical symptoms of depression? The typical symptoms of depression are sadness, anxiety, insomnia, loss of appetite, lack of social interaction with other people, and ultimately suicidal ideas. When you see that a person is having suicidal ideas, the best thing that you can do is to uh, direct this person to a psychiatrist, because it's an emergency and the patient has to be aggressively treated with antidepressants that are prescribed by the psychiatrist. As acupuncturists, we are not supposed to treat patients with depression with suicidal ideas by simply using needles to increase the levels of serotonin. So the most important thing that we can do is to uh, leave the patient being treated by a psychiatrist. And what medications are most commonly used in countries like America? Uh, they are mirtazapine, trazodone, um, um, fluoxetine, estalopram, sertraline, and others, many others. The common names they have are Prozac, Lexapro, Zoloft, or Paxil. And this is a brief view of how we understand that depression under a conventional point of view of medicine, and how traditional Chinese medicine investigate the causes of depression. They say that they argue that there is a lack of vital energy in the body that causes that drowsiness, that laziness, that lack of social interest in people, and excessive sleepiness, and this is due to a deficiency of the vital energy, chi, that circulates in the body, especially the yang aspect, which is related to the, dynamism, movement, initiative, that is decreased in the body. Also, an overcharged liver, that means a liver that's full of toxic substance, because we all know that the liver is the largest organ in the body and has a detoxification function in our body. And when it's stressed with excess of toxic substance derived from our nutrition, the liver tends to diminish the capacity of creating, the creativity. It diminishes your inspiration and decreases your insight. And these are emotional conditions that eventually lead to depression. Also, a weakness in the lungs, especially during winter time, provokes emotional triggers, emotional reactions such as withdrawal from people, vulnerability, susceptibility to criticism, to from other people, especially loved ones, and a kind of disconnection with the world surrounding the person. And this is also a form of presentation of depression, especially caused by weakness in the lung. Spleen is also involved in as a cause of depression. When we may have a weakness in the spleen, or an excess of action of energy in the spleen. When we have a weakness in the spleen, we experience feelings of worry. We have difficulty concentrating, and these feelings predispose to depression. When we have an excess of energy in the spleen, we tend to be more worried, and we have difficulty also concentrating, which predisposes to depression. Uh, when we talk about depression in traditional Chinese medicine, the kidneys are also involved. Uh, the kidneys may undergo a process of heating and cold. Uh, when the kidneys experience heat, I mean heat in terms of Chinese medicine, which has a different meaning from heat used in common English. Uh, we experience a lack of grounding. We lose contact with the reality surrounding us, and we tend to withdraw from people, from loved ones, even from pet animals. And this is a cause of depression. When we have a cold kidney, we tend to experience feelings of despair, of fear, and a decrease in the libido. And this is also predisposes to depression. So these are basically the causes of depression according to traditional Chinese medicine. Now I will start an acupuncture session of depression. I'm going to invite my patient Joyce, who really suffers from depression, who was taking antidepressants for a long period of time, and she experienced a number of adverse effects like nausea or decrease in libido, in sexual function, and she had a constant feeling of being addicted or creating not addiction because antidepressants are not addictive, but creating a chemical dependency to the antidepressant that she was actually consuming, and an increase of this antidepressive over time because they tend to lose its efficacy over prolonged periods of time. So we have to change the antidepressives that we are using, and it's a very common reaction that occurs with almost any medication that we use. A lack of a diminishing of its effectiveness over time. So I'm going to invite Joyce to lie down on that here. And to be very succinct, I will apply acupuncture using acupoints, traditional acupoints on her body, on just one side of her body to make presentation easier and faster. This part of the treatment is more of concern to acupuncturists because many of the acupoints used are not known to physicians and to lay people. So these needles that I will use are mostly of concern to acupuncturists. So I will start from head to toe the application of the needles. I'll use middle-sized needles with no plastic cover because in some of them I will apply a moxibustion. I will heat up the needle. So if I use a colored needle with plastic, either blue or red or green, which may be very easily visualized in the video, I will, on the other hand, be impossibilitated to heat these needles, which is necessary since we have the intention to tonify, to strengthen these organs that lack vital energy. So I will first apply at a very typical point, which is called intake. Hold skin here and gently apply the needle on the forehead. This is the intake point. Then I go to the top of her head here and apply the needle on my 20 point. I may also use extra points. So in this case, I will use the Sishin needling, which is 5 needles that form a kind of cross in which in the center lies the needle to my tray. So I will put every needle about 1 cm or 1 column away from the central needle. I will move to her chest, and I will apply insert a needle at the heart, which is called shan in traditional Chinese medicine, which is the where it's located, the soul, the spirit, and the heart of the person, literally. So this point is known as Ren Mai 17. You can observe but I insert the needle almost horizontally to the surface of the chest. And this is a very important point to treat depression, and especially anxiety. Then I go to the hands. I know that it's going to be very difficult to see because the camera is afar from her body, but I will try to explain what needles will be inserted. First, I insert the needle pericardium 6, PC6, right here, at 2 cents from the pulse here. Then I will apply 2 needles along the triple heater channel or triple burner. I take the second metacarpal area and the third metacarpal area. I find a kind of space here, free space here, and I needle this place. This is triple heater 3. Now I will apply a needle on the triple heater 5, which is exactly opposed to the pericardium 6. It's 2 cm from the cuff here. In medical acupuncture, we tend to insert the needle at a much greater profundity than than most acupuncturists insert. We tend to insert very deeply into the skin, reaching the muscle. So we have to be very careful because, as I told you on the previous video, this is medicine and this is an invasive form of medicine. So we have to be very careful about not puncturing the radial artery or the tendons here and provoking some sort of pain or wound. Now I will insert 2 needles. I turn the hand with the palm of my hand showing, and I apply this needle. It hurts a little at heart 7, along the channel of the heart. Okay, and then I take the lung channel and I insert near the cuff another needle. I will apply a little deeper at lung 9. So I'm almost finished with the hand. Then I insert a very important needle, which is large intestine 4. To insert into the large intestine 4, I pick up my hand and I touch her hand like this. And I insert the needle close to her finger. Did you feel any electric shock? When a person feels an electric shock, that means that we have triggered what the Chinese people call touching, which is an indication that we are inserting the needle exactly at the acupoint indicated. Then I go to the leg and insert the needle at gallbladder 34. So you have to touch the tibia, the femur, and the tibial plateau. You definitely you have to feel the region rather than measure the region. So it's located here because you feel there is a kind of pouch, muscle pouch here, in which you can safely insert the needle. So you see, inserting. So this is gallbladder 34. Then I will insert another needle at stomach 34. So I measure a 3 cm or cone from the lower part of the knee approximately, and I pick up the area and I touch again. I try to feel the location, and then when I find the area, I insert the needle. You see that when you find the exact point where the needle is inserted, let me push a little here. The needle is inserted here. The needle penetrates very deeply from all its length into the muscle, reaching the nerves there. And that's the right way of practicing acupuncture according to my Chinese professor. I had 10 Chinese professors from all over the continent, all over the country of China. And acupuncture, depending on the region, if it's septentrional or meridional or eastern or western region or Taiwan, the acupuncture technique differs. And they explain not to be so concerned, rationally concerned as Western people are about the number of sums that we have to use to apply the needle at a certain acupoint. We must rather feel where the acupoint is located, especially if it's a very well-known acupoint like Sesame, which is stomach 36 here. It's very good. Why I'm needling the large intestine 4 and stomach 34? Because sesame and large intestine 4 are points in which you increase the circulation of qi, of vital energy, all through the body. So since we have a lack or a deficiency of circulation of vital energy in the body, we stimulate these areas so that the energy can circulate better throughout the organs and the surface of the body. The other point that we'll choose is very much used and perhaps one of the most important points for treating depression. And it's right in the middle of the leg. And it's called stomach authority. Right here. It removes mucus and phlegm. And I pick up the needle and I insert, since the spleen is effective, I insert over the shoulder from this point of view. Okay, there's the malleolus here, the inner malleolus here, and I measure about 3 centimeters, and I insert at the needle at spleen 4. She found a little shock. That means that I triggered touching, which is very important. The more we needle at the right point, the more touchy we trigger when using acupuncture. And in this case, I've reached the right point. It's interesting that this point, spleen 6, is also used to decrease weight. It helps to lose weight at this point. And since the liver, with excessive toxicity from bad nutrition, is also untreated. We use the point liver 3 right here between the thumb and the finger. It causes a little discomfort, right, Joyce?
Yes.
And we can go to the next part of the treatment, which is applying oxybustion. I turn on the oxybustion. Here in the camera, you see that it's becoming orange in color. And when it's very hot, I apply on certain points to tonify, to strengthen, to give energy to this point and to this meridian or channel. Okay, so we will apply on the liver, this little bead, warm up the tip of the needle, insert it in the muscle to a temperature of about 50 degrees Celsius. Since I have a big breathe, I will apply here at stomach 40, and here at stomach 636. At gallbladder 34, and on the hand, very carefully, the triple heater 3, the triple heater 5. You pose the needle on the volar aspect of the arm, which pericardium 6, at heart 7, and at lung 9. By inserting the moxibustion into these needles and heating them up, I tend to strengthen the channel and provide more energy, more chi to the organs which are affected by the channel or meridian. And as you have seen, I have avoided to use moxibustion on the chest and on the head. My Chinese professors explained to me that if you apply heat on Rheumatoid 17, for example, you create an agitation in the heart and spirit that disturbs emotionally and psychically the person and has a very bad effect on treating a disease such as depression. It also applies to the intang here and the Sishin points on the top of the head. As a rule, we have to avoid to apply heat on any of these areas. Now I'll turn off I'll remove the needles. Sorry for my cell phone ringing. I should leave these needles for about 15 to 20 minutes because there is the release into the bloodstream of a lot of serotonin, and I have to tonify, I have to tonificate to strengthen these meridians, these channels, and the organs involved. So the right thing to do is to leave the needles for about 15 to 20 minutes. I suppose the time has passed, and then I remove the needles, which is a great alleviation to joys. Scare the needles. I remove the needles on the top of their head. And session, the acupuncture session is yet not finished. I will turn upside down Joyce and massage her back with natural oil. Oh, I forgot one here. That's one of my greatest mistakes in Chinese. So she's using a very loose piece of cloth. I always tell patients to use clothes that leave the area that's going to be used for acupuncture as free as possible. I remove the top. I apply medicinal oil made of coconut oil as the base, and essential oils of lavender and arnica. I gently apply over her back. Since I've studied dermatology for nearly 3 years, it's obvious that the oil will not penetrate the corneal, the keratinocytes of the skin, and because it forms a mechanical barrier, so the oil will not penetrate the dermis and will have no relaxing effect, in fact. Uh, but what most patients feel is relaxation caused by the aroma that is released by the lavender on the surface of the skin. This creates a great relaxation. And we can think about aromatherapy as a form of treating depression. And lavender is certainly one of the substances used. But I use the oil to create more adherence because I will apply a suction cup of medium size on the surface, applying very little pressure, and I will gently massage her back, the cervical region, which accumulates a lot of inflammation and pain in contracture of muscles. There's a lot of muscle spasms in this area. I always ask the patient if she's feeling any pain. Joyce, are you feeling pain?
No.
No. Because if you use a lot of suction, you cause pain on the skin of the patient. The pressure hasn't diminished. The real blood pressure. Again. I do this for about 5 to 7 minutes until relaxation in the back is attained. After a few minutes of applying massage, I remove the suction cup. I grab a napkin and cleanse the surface. Some patients ask me to add the oil on because they somehow feel better. Tie up the top. Now the patient is ready and the session is finished. If you enjoy the video, you can subscribe to it, give your like, and post your comments. As an acupuncturist, you have to understand that the technique I'm using here probably is different from the techniques you have learned in your countries, because the acupuncture techniques differ very much from country to country, and even within the original country, which is China. So there is an acupuncture type of application for every region of China, as there is a specific physiotherapy for every specific region of China. And probably you must have seen differences in inserting the needles and applying the suction cups, which is absolutely natural. What is important is the final, the end result, if the patient is feeling better. and she just started the treatment. She's going periodically to the psychiatrist, and she's diminishing the amount of antidepressants and reducing the side effects that she's feeling. And she's about to abolish the use of antidepressants in her case after a number of sessions with the supervision of her psychiatrist. So that's all for now, and I hope you have enjoyed the video about depression. Thank you very much. Until next